Hello, I'm Dr. Ajitabh Srivastava, Senior Consultant Hepatopancreaticobiliary Surgery and Liver Transplant at Fortis Memorial Research Center. Today I will tell you all about liver cancer. Liver cancer is one of the third commonest liver cancers in our body, and it presents as a mass in the liver. A mass in the liver could be either cancerous or a non-cancerous. So a good imaging, a good quality CT scan identifies whether the mass within the liver is a cancerous or a non-cancerous mass. So once we know that a person has got a liver cancer, let us discuss what are the common etiologies for it. So the common etiologies for a person developing liver cancer is when a person has liver cirrhosis. Liver cirrhosis by itself is a risk factor for developing liver cancer. In addition, and the causes for liver cancer like hepatitis B, hepatitis C are the most commonest causes for developing liver cancer in a liver cirrhosis. So once we have a person with liver cancer and in the backdrop of liver cirrhosis, then we need to evaluate the patient in detail to know the functional reserve of the liver. If the functional reserve of the liver is good and the cirrhosis is not very advanced, then the cancer within the liver can be resected, depending on the size, depending on the extent of resection to be done. In a group of patients in which the liver reserves are not good and the cancer is within the liver, not outside the liver, in those patients, liver transplant gives a good outcomes and it gives a complete curative treatment, like the treatment when you have for the cancer of breast or cancer of colon, where the person gets completely cured of the problem. So when you do a liver transplant for a person with liver cancer and liver cirrhosis, you give dual benefit to the patient. You treat the cancer completely and you give a better functioning liver to the patient, so that the problems because of failing liver is taken care of. So overall the patient gets definitely more years to his kitty, he gets a better quality of life as well. So liver transplant is a very successful procedure. Done in stable patients, it gives a success of close to 95 to 97%. And with a very good long-term survival. And once a liver cancer is the cause for treatment for the liver transplant, liver cancer gets completely cured. In a small group of patients where liver transplant cannot be done, in those situations you can offer them non-operative treatment like radiation, like chemotherapy, and this will give the benefits to the patient for some time. So if you have any more questions, feel free to connect to me and we can give more details and give the right treatment what is required for your patient, or if you are the patient, feel free to connect to me. Thank you.